Hi, hello everyone. I'm Yang Gang, postdoc at Institute for Implementation Science. Really excited to introduce these amazing speakers for this building capacity for global implementation science research and practice. So first speaker, Dr. Gloria Sanchez. Dr. Sanchez is a professor at the University of Antioquia in Medellin, Colombia, holding positions in both the Faculty of Medicine and the National Faculty of Public Health. Her expertise lies in the training graduate student in basic biomedical sciences and epidemiology, specifically focusing on the development of clinical validation of molecular tools for early cancer detection. Dr. Sanchez established at the Infeccion and Cancer Research Group in 2006 and dedicated her career to researching and preventing HPV, cervical cancer, and breast cancer, particularly in low and middle income settings. She also engages in community initiatives to promote cancer research and prevention through license with the several governmental and nonprofit organizations. So, well, it's yours.
Well, thank you very much. Thank you, Dr. Maria Fernandez, for this opportunity to speak with you with this experience that we have training students from low middle income countries in Latin America, specifically through the Tropical Diseases Research Program, which is a program of the World Health Organization. So as you heard, I have been working on cervical cancer and HPV research, basically. So many of you may ask why I'm here. Well, basically because I saw the opportunity of this program to really implement training in several low middle income countries of Latin America. Meanwhile, I was participating as a teacher in the School of Public Health through the program of epidemiology. So I really got engaged 5 years ago in the training and implementation research, and at the same time to implement the implementation research competencies with, of course, the limitations that we have there to do it at a great scale. So, but I'm showing just our short experience, even though the time is very long, as you see, building this capacity is not easy, but I think if we work as a community, we can actually improve a lot. So the picture just showed the researchers or the students, excuse me, that have been trained over these 4 years in this program. As I say, this program is funded by the Tropical Disease Research Organization, or the World Health Organization, which is called TDR. And I'm going to use the term TDR all the time in this talk. So I will briefly discuss or present what the TDR is. Even though I am not part of the TDR, they fund us in this project. It's good to understand the framework that they use to develop this training, but also because I am a TDR trainee. You know, the TDR paid for my PhD when I did my PhD at Hopkins. So that became like the history, the importance of the research capacity that you build those capacities in low middle income countries to try to change things. So that is an example. And the other professor that works with me in this program was also funded by the TDR. That's one thing. And the other thing is that how we have developed the competencies for implementation research in this program, which is actually very difficult because there are very few programs in implementation research in low middle income countries. And the program that they have built up is the postgraduate training scheme in implementation research. And I'm going to show you more or less what they have impacted now worldwide by training several professors and programs over 10 countries in low middle income nations. I will also speak about what we have done in the University of Antioquia in terms of the human resources, how we have adapted the curriculum to the program that we have already there, and how we have engaged healthcare and decision-maker organizations, so Latin American low middle income countries, to try to train these students. And that was my question, because of course we are able to engage them, but we are not able to engage actually them, you know. So we work with them, but we have still at the stage of trying to see what will be better to do in order to really engage them. There are a poster out there in the hall in which you can see some of the impacts that we have obtained so far, like some 4 research projects, and also the numbers of the people and where they are now according to the career path. So the World Health Organization has actually developed and updated the strategic approach to try to control tropical diseases in low middle income countries. And the main thing I think that is very important to be clear is that they are aiming at implementing the interventions to reduce the burden on infectious diseases. And when they do that, that actually put implementation research in the central core of the idea. So this is a very good vision, I think, and I will say for low middle income countries because they can make a case of implementation research if the World Organization and the TDR program pushes for this research in these environments. So they aim at strengthening the capacities of people, institutions, societies to produce research evidence useful for reducing the burden of infectious disease or poverty. So far, they have selected 10 universities around the world. This was a competitive announcement, and we obtained the entry to this program in 2016, where we are the only university in Latin America that has been competing and getting this grant. And the idea is to train students from low middle income countries in implementation research. This framework was developed together with the School of Public Health at Johns Hopkins University, and also they integrated the institutions that have been selected within this process to develop the competence, the framework for competencies. Specifically, they also developed the standardized implementation research curriculum, but it's not like they have been developed yet. I mean, we are working in the process, and this is a learning experience. As much as you try to do it in each cohort, there is new things that are coming and new things to learn each time that you enter a new cohort to try to at least put the competency for implementation research. Just a short slide to show our history within this program at the University of Antioquia. We had the fifth cohort in 2016, and we are running now the fifth cohort. Specifically, just to say how much it took us to try to implement the full implementation research track. It was like a 2 or 3 cohorts. But of course, was the pandemic on the middle of that postponed maybe 2 years the idea to start using implementation research courses as such within the program that we have developed at the University of Antioquia. The thing is that we have assembled a very stable team that work together in order to develop this curriculum and the competence in implementation research. Specifically, the program was started with Dr. Maria Patricia Arbeláez and Edwin González, who were the former and the current dean of the School of Public Health. And this was very important for us to sustain this program, because it was very difficult at the beginning to try to make them understand or make everybody understand what was implementation research. They actually wanted, or many people wanted us to use health operational research, as a title of the program. But we resisted and say, no, this is implementation research, but we teach also the terminology and many things that we know that they need to understand in order to allow us to change a little bit in the program. Now I work with Dr. Carlos Rojas in trying to make the leadership in the implementation of the competencies, and we are training 2 young researchers so that they take over the leadership of this program in the near future. We have managed to engage a lot of other researchers from Latin America, and this is very important because they are becoming the experts on the interventions. Mapping of the intervention, knowing the intervention, knowing the healthcare system is very important. And they are the experts who are able to help us to understand how better to train these students in the context that they need to answer their questions. So that is a huge work, but also we have a collaboration actually for free time because they are volunteers in this program, but they also are gaining training and implementation research. We also leverage our capacities with this international center that has a long experience of researching leishmaniasis in Colombia, but they are also very well connected with World Health Organization and several different countries of Latin America, and they now have access to implementation research grant in which we have leveraged capacities in order for us to try to participate in webinars to enhance our capacities and competence in implementation research. This is a scheme of the program that we are running. We embedded the implementation research program in our program of epidemiology because we were, at the beginning when we were discussing, we saw that the possibility to conduct studies, especially hybrid studies, will need that type of skill for the student. However, there was a lot of controversy if that will have to be done within the public health program or within the program of epidemiology, where we still have a lot of tension on that discussion. It's not something that we have made the decision yet. But here you can see it in blue and green, all the tracking implementation research. And one thing that we changed completely in our program is that the students develop the research proposal with the home country stakeholders. So once they got in Medellin, in order to start the program, we start pushing them, basically, telling them you have to go and engage the stakeholder of the intervention that you want to work with your home country. You have to deal with the communication and ask what is the need that they have. This is the first question that they have to answer. What is the need within the country? And after that, we start helping them to build the research question. So it's a going forward and back process that it takes time, but it builds a very significant project. And at the same time, we are asking them to have the research proposal ready to pass for the committee evaluation of the quality of the proposal and also the components of the implementation research. Then after they have finished to build the research question and the proposal, they do a field work in the home country. So they began to have more near work with the implementers and especially decision makers, collecting the data with them, and then they get back to Medellin to do the data analysis. These are the examples of institutions that we have engaged, or basically, we have supported graduate students to engage to develop their thesis. So basically, there are, from the 14 countries of low middle income countries of Latin America that have participated in this study, with a lot of effort, of course, that the students take to do, and a lot of stress, because sometimes the timing of the stakeholders is not in the timing of the time that they have to graduate. So they are rushing specifically to finish the thesis and go back to the countries. But it has been a really, I think, rewarding experience, because we know now very well what is the importance for them to face the problem that they have in their country when they are going back. So this is, I think, a very important step in order to train these students from these countries. And finally, just some metrics and numbers. We have a lot of requests for applications. There are many people that actually write us and ask us if they can apply for the program, but the program has a very strict requirements or criteria for inclusion. The people has to be 35 years or younger. They have to be nationals and residents of the low middle income countries of Latin America. We have 321 applications in this 4 year, on these 4 cohorts during this time, but we only, because of the resources, have accepted 56, and we have, of course, awarded this number of fellowships. So far, we have graduated 44 students, and mostly of them are from the low middle income countries, but specifically working in diseases of poverty, in a very extremely low resource settings in which really they are facing huge challenges to implement these interventions that are actually the interventions recommended by the World Health Organization to reduce the burden of diseases of poverty. Thank you very much.